Maybe as people are rolling in, I'll just start with my opening remarks and then people can join, and hopefully by the time I'm finished, everybody will be here for Lianne's presentation. So I just want to say hello. My name is Wendy Craig and I'm the scientific co-director of PREVNet. And on behalf of our team, I want to welcome you to our webinar today. We're gathered online, and each of us from our own location and across traditional and unceded territories of probably many nations. We all have a different relationship to the land, and I'm here as a fourth generation white settler. And as a settler, I feel like I have a responsibility to understand my relationship to the land and be an active part of reconciliation. Today, I'm situated in an area that's referred to as Cataraqui, meaning meeting place, which seems appropriate that we're on a meeting place together today online, and I'm situated in an area that's named as such. The traditional lands that I'm situated on are the lands of the Anishinaabe and Haudenosaunee, and I'm grateful to their generations of those Indigenous settlers who have taken care of these lands. And it is in the next hour, I hope that we bring our hearts and our minds to this presentation and to this wonderful meeting place. We're bringing today's webinar from the Community of Practice to address teen dating violence that's funded by the Public Health Agency of Canada. And I'm very pleased that Lianne Lee is presenting today on lessons from implementing an Alberta-wide train-the-trainer approach for scaling up evidence-based healthy youth relationship programs in schools and communities. Before I introduce Lianne, I wanted to just go through a bit of the format for today. We have posted a link to all the presenter slides in English. You can find that in the chat box. And the webinar today will run for about an hour, and we'd like it to be as interactive as possible. So please ask any questions along the way using the chat box. And we also plan to have about 15 minutes at the end of the webinar to address your questions. We will save all the questions and we'll go through them at the end of the formal presentation part. We also, at the end of the presentation, you'll see a link to an evaluation of today's webinar. Really important to us as an organization that you answer or participate in this evaluations, because they help us with future planning and they help us do better. So your feedback is anonymous, and so we really would be grateful if you take those 2 minutes at the end to complete it. Once you've completed the evaluation form, you'll be directed to a website where you'll be prompted to enter your full name and address, and that will enable you to get your download of certificate of attendance that will be generated and emailed to you. And I just want to stress the evaluation and the certificate of attendance are completely separate. They will never be connected in any way. I also want to note that today's webinar is being recorded. So afterwards, we'll send out the webinar link to everybody that's registered, and so they can share the recording with people that they may think may be value or learning from it or listening to it, or if they weren't able to join us. So that's all I have in terms of the logistics and the welcome. So it's now my great pleasure. I had the honor of meeting Lianne a couple of years ago, and I've always learned when I spend time with her. And I think one of her gifts is that her background in education, she has an amazing way of understanding the needs of the audience, sending the messages at a level that the audience can understand, and always coming from an evidence-based approach. So it's my great pleasure to introduce Lianne Lee, who holds a master's degree in educational research and a bachelor's degree in education, economics, and society in English. Since 2006, she has led a broad range of community programs and system change initiatives that seek to enhance the well-being of children and youth from many diverse backgrounds. Over the past 2 years, Lianne has managed the design of Alberta's primary prevention framework to develop a provincial policy framework to stop domestic and sexual violence before they start. So she has lots of experience in the field and a strong research and educational background. And I'm very grateful to have you here today, and welcome. And I look forward to hearing your presentation.
Oh, well, thank you, Wendy, for such a generous introduction. I too always learn from Wendy, whether it's in person or through her research. So thank you so much for inviting me and for the powerful land acknowledgement as well. So let me share my screen and I will get started. Okay, just creating some settings. Okay, so is everybody seeing the right slide? I don't see faces on this view for some reason, but if I don't hear anybody stopping me, I will just keep going. So thank you everybody for participating and being a part of this webinar. I am so happy to be here, and I'm the director of the Alberta Healthy Youth Relationship Strategy with Hrpp, the project to end domestic violence. Today, I will be sharing with you some lessons that we've learned from implementing an Alberta-wide train the trainer approach for scaling up healthy youth relationships programs in schools and in communities. So this presentation, I'm going to provide a bit of context around what adolescent dating violence is very, very quickly, just so that we're on the same page. But the bulk of my time will be talking about the Alberta Healthy Youth Relationship Strategy broadly, and then specifically about scaling up healthy relationships programs, some key successes, lessons learned, and where we're heading. But before I get started, I just wanted to emphasize that I stepped into this project during the last few years of its implementation. And much of the work that I'm going to be talking about was led by others at Hrpp, including Lianne Wells, the director of Hrpp, Dr. Dayanara Exner-Cortez, and the previous director of the Alberta Healthy Youth Relationship Strategy, Suzanne Zwarwich. So I did want to recognize all of their contributions and leadership to the project, and of course, our project partners, PREVNet and Western University. All right, so some of you may be familiar with Hrpp, but for those of you who aren't, we're located in the Faculty of Social Work at the University of Calgary. And as you can see from the slide, we sit at the intersection of research, government, and community because we think that's a sweet spot for social change. Hrpp is a primary prevention initiative, which means we focus on stopping violence before it starts. And a large part of our work focuses on summarizing research for different stakeholders and then partnering with them to test and integrate best and promising practices so that we can together advance social change. Hrpp has multiple priority areas, and you can check them out on our website. But today I'm going to focus on our priority to support youth, to promote healthy youth relationships and prevent dating violence. And at Hrpp, we focus on youth because, as most of you on this webinar already know, healthy relationship behaviors in adolescence contributes to the prevention of adolescent dating violence and ultimately contributes to the prevention of adult domestic violence. I know most of you are experts in this area, but just so that we're grounded with the same understanding of what adolescent dating violence is, here is a definition of it taken from the PREVNet website. So ADV, or adolescent dating violence, is aggressive, threatening, and/or manipulative behavior occurring in adolescent romantic and sexual relationships. And as you can see from this slide, and I won't go into details, again, a lot of the stats here are taken from the PREVNet website, but ADV is a very serious issue, and 1 in 3 youth who have dated reported ADV victimization. So we know that dating violence experienced during adolescence significantly increases the odds of future victimization by a romantic partner. And there are also lots of negative impacts that I'm sure many of you are aware of, like depression, anxiety, suicidality, problematic substance use, sexual health issues, and many other negative consequences. So it is a very serious issue, and that is why it is so important to prevent violence before it starts, which was the focus of Hrpp's Alberta's primary prevention, Alberta Healthy Youth Relationship Strategy. So between 2010 and 2018, Hrpp led a comprehensive strategy to promote healthy youth relationships across Alberta called the Alberta Healthy Youth Relationship Strategy. And we worked at all levels of the social ecological model that you see on the screen, which is a key violence prevention model that shows that individuals influence and are influenced by their environments, including their families, communities, the policy and legislation context, and the social and cultural context as well. And so that means that to effectively prevent violence, we really need to be working at all of these levels. And that's exactly what we did through the Alberta Healthy Youth Relationship Strategy. I'll very quickly whiz through some of the work that we did in the outer rings of the social ecological model, and then zero in on what we did in communities and with schools and families and youth, because that really is the heart of the train the trainer model. But I do think it's valuable to just very quickly share what we did at those other levels as well, because they all reinforce one another. So at the social and cultural level, we focus on influencing faculties of education, knowing that if we build capacity of administrators and educators, they would then go into communities and schools and create environments that promote healthy relationships. So we partnered with the Hrtn School of Education here at the University of Calgary, and we developed a 4-course graduate certificate program called Advancing Healthy and Socially Just Schools and Communities. And this course focused on healthy relationships, anti-oppression work, trauma-informed approaches, and other topics related to youth and relationships and social justice. This course has been going on since 2015. We also hosted undergraduate symposium series where we brought together social workers and social work students and education students to discuss how together we could promote healthy youth relationships. And the idea here was that if we start to embed evidence-informed information around ADV prevention, healthy youth relationships in undergraduate programs, they would graduate and then of course bring those skills and knowledge out into communities and schools. We also partnered with the Hrtn School to design their healthy youth relationships component of a mandatory course around comprehensive school health. So this course is mandatory and taken by upwards of 500 Bachelor of Education students every year. So again, our goal is how do we ensure that future generations of teachers have the knowledge and skills and confidence to be able to promote healthy relationships in their schools and classrooms. Quickly, around policy and legislation, we were invited by the previous Ministry of Education to help design their K-12 curriculum. And our recommendations, of course, focused on ensuring social emotional learning was a part of the curriculum so that then teachers could actually implement evidence-based healthy relationships programs. We were also invited by the Ministry of Children's Services to provide feedback and recommendations on how to promote youth well-being. And again, we emphasize the importance of preventing adolescent dating violence there so that we could inform government strategies and investments that would then, of course, trickle down into schools and communities. So those are some of the more broad pieces of work that we've done that I think are valuable to share because it feeds into the next part, which focuses on schools, communities, families, and youth, and is really the heart of our train the trainer approach. So one of the key goals of the Alberta Healthy Youth Relationship Strategy was to cultivate healthy relationships in youth via evidence-based and evidence-informed programming in schools and community settings. So we partnered with developers of healthy relationships programs, Western University and PREVNet, and we also partnered with school divisions, schools, community organizations, the government of Alberta, and anybody working with youth to scale up these 3 programs. And I'm sure that many of you are familiar with these programs, but very quickly, if you aren't, the 4th R is a program that was developed by Western University, and it is taught by teachers and is connected to the Alberta grades 7 to 9 curriculum. It really focuses on dating violence and related risk behaviors. And it's based on this idea that we can teach relationship skills much like we teach the other R's, which is reading, writing, and arithmetic. The Hrpp program, or Healthy Relationships Plus program, also developed by Western University, is taught by community professionals in a small group setting. And it was developed as a version of the 4th R that had an enhanced focus on mental health. And then the last program that we scaled up was the Healthy Relationships Training Module developed by PREVNet, and it's still available as an online option, I believe. And Wendy, you can correct me if I'm wrong, on the website. And this is a formal training for any adults who work with children and youth. And it really focuses on building the capacity of adults to promote healthy relationships in different contexts and environments. We also piloted 4th R resources for parents. And the idea was that we wanted parents to also understand the 4th R program and to have productive conversations using the same language that children and youth were learning through the 4th R program. So we partnered with Western University again to develop homework assignments, online modules, along with face-to-face workshops to build capacities in parents of adolescents. So maybe I'll stop here and maybe I'll ask the question, and it's unfortunate because the setting on here doesn't allow me to see the folks on the call, but because I can't see that, I might just skip through this slide and we can maybe talk about it during the question and answer period. Okay, so now let's briefly talk about the overall structure of the Cascading Train the Trainer model that we implemented in partnership with so many important system actors. So as I mentioned, Hrpp partnered with Western University and PREVNet to scale up the 3 healthy relationships programs that I described in the previous slide. And Hrpp also partnered with school districts and schools, a variety of community-based organizations, and the government of Alberta to ensure that there was support at the institutional level. And these institutional partners were responsible for allocating at least one person who was at the leadership level or the management level who would advance the project within their region. So it was really important for us to get that institutional support and to identify that key leader who would become a master trainer in our Cascading Train the Trainer model. And I'll talk a little bit more about some of the kind of mechanics or details of that role in a bit. The idea was that we now had a set of master trainers from diverse partners, and we created a cohort of master trainers who together would train teachers and people working with youth within their regions on those 3 healthy relationships programs. So they would train teachers via the 4th program, and they would train people working with youth or community professionals through the Hrpp program and the Hrtn program. And so the teachers and then people working with youth who received the training were now able and had the competencies to then implement those healthy relationship programs and practices out in the community and in schools with youth and with parents. So that's just the overall structure of the Cascading Train the Trainer model. And if I were to use a very, very simple visualization of this cascading model, it would look something like this, but this is just for visualization. It isn't an actual mapping of where the trainings took place, but I just think this might give a better idea of how this cascading approach worked across Alberta. So as I mentioned, Hrpp partnered with Western University and PREVNet. We partnered with school districts across Alberta, along with community organizations and the government of Alberta, who then identified specific people within their organizations and institutions who would become a part of our master trainer cohort. And these master trainers would then train other folks within their region, teachers and people working with youth, who would then implement healthy relationships programs and practices within their settings. And so the goal here was that at some point, this entire map would be colored with school districts, schools, community organizations, leaders, teachers, professionals, people working with youth, and then youth and parents themselves would all be participating and promoting healthy youth relationships. All right, so I'm going to switch gears just a little bit. We've talked about the structure, overall structure of the Train the Trainer model. And now I want to dive a little bit deeper into the process, starting with institutional support. So I did talk a little bit about this already, but it was just really, really important for us to ensure that we had institutional support to effectively scale and sustain the approach. And it was quite a process, actually, to become an institutional or organizational partner. First, the institution or school or community organization had to apply to become a partner within the project. And this application form was quite extensive because we had to understand the readiness of the school or the organization. We wanted to understand their commitment to it. We wanted to understand what kind of resources were already happening in these environments so that it was a good match for our project, because we wanted to hit the ground running with scaling. We didn't want to have to meet schools who weren't ready for this type of approach. And so through that process, we also had to develop a memorandum of understanding with each of our partners, which, as you know, especially with a university, is quite the process. But it was really important for us to develop that so that we had an understanding of role and responsibilities. And then, of course, the institutions and organizations had to identify a department lead or a manager within their organizations who would become a master trainer. And so the goal here is we really wanted commitment, clear roles and responsibilities, and an understanding that our partners needed to also contribute resources to this partnership so that they bought into it and that they understood that they were partners and not just beneficiaries of the partnership. The next part was around master training and certification. So once we identified those leaders, those department leads, and those managers who would become master trainers, we had to work with them through a process of certifying them to become a master trainer. So the process for becoming a master trainer for the 4th R Hrpp were quite different from the Hrtn. And very quickly, I'll just talk about the process for 4th R and Hrpp. Folks had to participate in a 2-day training hosted by Western University. They then had to shadow a master trainer who was already certified during one of the trainings. Then they had to co-facilitate a training out in a school or a community. And then they had to solo facilitate. And through this whole process, a certified master trainer would observe these master trainers in training. And if they successfully completed all stages, they were then certified as a master trainer. The Hrtn certification was a little bit different and a little bit more simple, where if folks participated in an Hrtn, they could technically then train others in it. What we found was that often folks would still reach out and ask for advice or ask for tips in how to actually train other adults or other professionals as well. This master trainer cohort met twice a year as an entire cohort. So we would either fly to Calgary or fly to Edmonton or drive, and we would meet and we would discuss our challenges, our successes, what was working, what wasn't. We also participated in capacity building and training on specific topics related to healthy relationships. So this was an opportunity to really build a community of practice. The master trainers also received a lot of administrative support from Shift and from the program developers, and I'll talk a little bit about that. And then when appropriate, organizations or master trainers were also compensated for their time and their expertise. And I'll talk a little bit about that as well. Okay, the next phase of the process was coordinating the training. And let me just go back, coordinating the training. And I think this is an important piece to talk about because there's so much background work around coordinating trainings that I don't think folks always anticipate. The promotion that needs to happen, the calls, the questions that schools and community organizations might have, making sure that we have attendance sheets set up, making sure that all the resources are sent to the school or the community, all of this background stuff that happened and that Stacy at PREVNet really played a key role in supporting that work is really important to think about when scaling up programs, because when you can just imagine if you have 30 trainings in 1 month and each training has 25 teachers or professionals, that can be quite a heavy administrative task. And that's just something to think about when scaling up healthy youth relationship programs. But once those trainings were booked and coordinated, they actually had to happen. And this is where the master trainers would shine. They would go out into the schools or out to the community settings and work with teachers and professionals or adults to promote healthy relationships and to develop skills to promote and implement programs. And I think that the important thing to note about this from our model is that there was no cost to the master trainers, the schools and community organizations, nor the teachers and people working with youth to participate in the training. And I think that was a really important driving factor for uptake, right? Because resources and budget are often barriers to actually implementing and advancing these programs. So this is all covered by our funders of this project. The training materials were also mailed directly to the schools and the community locations. So many of you may know that the 4th program and the Hrpp program, they have resources that teachers follow, and those are mailed out directly to the locations, again, at no cost. It was covered by our funders and covered by the project. And then teachers and people working with youth received ongoing technical and content support from master trainers and Shift. And this was a really important piece for many teachers and professionals working in the community, because after they were trained and they were then asked to implement the programs, understandably, there were always hiccups, questions, or things like, oh, I didn't think about that. How do I navigate through this challenging situation? And that's, again, where master trainers would shine, because they could coach and provide advice to those teachers or professionals who were looking for some additional support. All right, and then the next piece I'll talk about is evaluation and knowledge translation, which I think is also a very critical piece of scaling. We need to understand how it's working and how is implementation going, and are people actually participating? We need to understand those in order to ensure that we're being effective and reaching our outcomes, but also course correcting if things aren't working. And so Shift really took a leadership role around evaluation and knowledge translation. And there were a series of pre and post training surveys to understand how the training worked or didn't work for teachers and professionals. We also tracked everybody that we reached through the project. We shared implementation surveys to understand how implementation of these healthy relationships programs were working or not working out in schools and in the community. The previous Alberta Healthy Youth Relationships Provincial Director also submitted monthly reports, because she sort of had this bird's eye view of how things were going across the province, and her perspective really helped to shape how we would advance the model. We also had annual surveys and interviews with our master trainers to understand how that scaling approach was working or not working in specific regions across Alberta and in different contexts. And then, of course, the last important piece is funding. And like I said, so much of this was covered by our funding partners, the Government of Alberta. Some of it was Calgary Foundation later on. And then, of course, PREVNet and Western University also had their funding resources that they contributed. So it really was this partnership and across organizations, across research institutes, across school districts, at the institutional level, all the way down to the individual level. Okay, so let's move on. Oh, I'm not sure. There we go. Sorry about that. So I'll talk very briefly about some successes, some lessons learned, and where we're headed. So some key successes over the 5 years of scaling the project is that we established some really important partnerships with the Government of Alberta, with Western, with PREVNet, with school districts, with community organizations. And we know that these kinds of partnerships are critical for preventing dating violence in a comprehensive and collaborative way. We developed this master trainer cohort that consisted of 16 senior leaders from across each region in Alberta, and they became this community of practice that would be an expert in their regions for others to reach out and to ask for support. We also built the capacity of parents. And this is a really important piece. It was both a success and a challenge, and I'll talk a little bit about that later. But I think it was important to note that we didn't just focus on the youth. There was an understanding that we also needed to support the primary caregivers or the parents of adolescents as well. And I think the last major success is that we did scale up evidence-based healthy youth relationships programs across Alberta and created this provincial climate where folks were promoting and committed to advancing healthy relationships. So the numbers reinforce that because we tracked reach. And you can see on this slide that between 2013 and 2018, we partnered with 317 schools, trained about 1,600 teachers, reaching over 83 grades 7 and 9 youth. In the Healthy Relationships Plus program, 828 facilitators trained, reaching over 18,000 youth. And then with HRTM, we trained over 800 adults who work with youth. So we're very proud about this work and also incredibly thankful for all the people and partners that have made it possible. All right, so some lessons learned. The first thing I'll talk about is the importance of influencing school climate to improve teachers' implementation fidelity. And our research shows that even though teachers received training and had the resources at no cost, many had a difficult time implementing the programs with fidelity because they needed greater school level support and buy-in. We also learned that we need to engage primary caregivers or parents where they naturally go, as school settings, especially during after school hours, may not be effective places. We really need to think about what are parents' priorities, how is their time limited, where can we reach parents in workplaces, in the community, where they need to be to support their children. We also learned that we need to deepen our engagement with the Ministry of Education. So we built a fantastic partnership with the Human Services sector, or ministry, sorry, but we didn't develop that same type of partnership with the Ministry of Education. And because these programs are largely implemented in schools, we really need that. And if anyone has any tips and tricks on how to get into that, I would love to learn from you. Next, we learned that we have to continue to explore how best to facilitate systems change. And what I mean by this is that scaling up programs, while super, super important, is not the same as systems change. So for example, our master trainer cohort was effective at sharing information, building capacities and knowledge, and certainly scaling programs, but we did not quite get to the next level of change where we would collectively shift legislation and policies, change resource flows, and uproot some of the power dynamics that hold ADV in place. So we didn't quite get to that systems change yet. And I think that's an important learning for anybody that wants to scale up healthy relationships programs, that there are limitations. And the next lesson learned is that we need to focus on high quality implementation of evidence-based programs and support appropriate adaptation. So many teachers and professionals remarked that some of the programs felt a bit prescriptive and didn't necessarily reflect the lived realities of the youth and families they worked with, especially those from marginalized backgrounds. And the last key learning I'll mention today is that we learned that programs that target youth alone are not enough to prevent ADV. We really need to ensure that the contexts in which youth live, learn, play, worship, work are effectively promoting healthy relationships as well. So while scaling healthy relationships programs that focus on youth is important, it's not enough to truly prevent ADV. So how can you use what we've learned over the whole scaling approach? I will share just 4 ideas today, starting with the ones on the outer ring. And they're more theory-based, but I think it's really important that we draw on good theory to inform the design of our Healthy Relationships program, as well as the implementation of our programs. So starting with implementation science, and I know many folks on this webinar are familiar with it, but if you aren't, implementation science really focuses on understanding how to implement programs effectively. And 15 or so years ago, the science on prevention really focused on developing programs to address risk and protective factors. And we've been able to identify there are certain programs that definitely work and we should scale those up. But we also need to find ways to effectively implement those programs. So a program alone is not enough if it doesn't come with really good implementation. And that's where implementation science can help you to effectively scale programs and increase the likelihood of socially significant outcomes. The next area that I would encourage folks to draw on is critical theory. And many evidence-based programs are developed through a very Eurocentric, middle-class, heteronormative lens. And I know that over the past handful of years, some program developers have certainly created adaptations of their programs to focus on different populations like Indigenous peoples or 2S LGBTQ plus youth. And that's fantastic. We need to keep going down that path. But I think we need to do more still to ensure that our healthy relationships programs are appropriate for youth from all backgrounds, including those from racialized backgrounds, youth with disabilities, Indigenous youth, and youth living in poverty, for example. And so I think that drawing on critical theory can really help us design better programs and offer appropriate adaptations, because it considers how our power, privilege, and inequalities are baked into our systems, structures, and social norms, which of course impact our life experiences and impact the ways in which people develop and maintain relationships. So I'll give you one example of how this might show up in practice. When I was training some teachers, somebody said, well, you know, I get it. Assertive communication, which is one of the key skills that we often emphasize. Assertive communication is important, but some youth who use assertive communication in their homes or in their communities might actually face very serious consequences. And so, you know, how is our promotion of assertive communication skills sometimes creates a bit of a tension in terms of the lived realities of many youth. So I think that drawing on critical theory can really help us not perpetuate practices that harm, and instead really promote the strength and resilience of youth from marginalized backgrounds. The next few things that I'll mention really focus on creating supportive norms and environments that promote healthy relationships so that you can implement healthy relationships programs. It really needs to be this whole school, whole community approach. And what does that mean or look like? Well, it means that we have to get commitment engagement from leadership. That includes district leaders, community leaders, because they really need to prioritize healthy relationships and social emotional learning in their schools and in their communities. So I'll give you, I'll keep going. The next one is around engaging the right people. And it's really important that we consider and ask ourselves, are we engaging the right people to scale evidence-based healthy relationships programs? I'll give you an example. If only the frontline staff of community organizations are trained, but the managers of those organizations aren't trained, then the frontline staff don't really have anyone to turn to when they're struggling with implementation. Right? So it's really important that systems leaders or those scaling programs really think about that coaching model that needs to be a part of the scaling process. Another example is that there are some people that are really great at working with youth and implementing healthy relationships programs. But those skills are not always the same skills needed to train other adults and professionals. Right? Like we need to be looking at communication skills, coaching skills, mentoring skills for adults or professionals, which can be very different from skills working with youth. So we really need to find the right people to scale up healthy relationships programs. Next, we need to make sure that we are making time for staff to be involved. This is so hard because time is so scarce in so many of our schools and community settings, but it does mean that system leaders need to adjust staff's workloads or their schedules to ensure they can effectively implement the programs. I'll give you another example. As a community practitioner, if you're being invited to implement a 14-week program in a school, but the school schedule only allows for 10 weeks of programming, then the school needs to be willing to find more time or look for another program that actually fits the schedule. And both are really good options. But I think it's really important not to try to jam a 14-week program into a 10-week schedule, because then you're really compromising fidelity. Next, ensuring policies and procedures also foster healthy relationships or social and emotional learning. So if schools and community organizations are not prioritizing this, within their policies and procedures, teachers and practitioners often feel like they're just doing this work off the side of their desk with very little recognition and limited support. And as a result, it tends to fizzle out and doesn't scale up. And the last thing is a robust community school collaboration. And so how do we ensure that what's being taught in the schools is being reinforced in the community and vice versa? And I think that this community of practice that PREVNet is coordinating is a really good example of how we start bringing these two sectors together in a more meaningful way. And the last thing that I will talk about here is around social emotional learning for adults, teachers, administrators, support staff, community organization staff, because we also need to develop our own social emotional learning competencies in order to be able to foster those in youth out in the community and schools. And this includes developing competencies around equity literacy, which involves recognizing, responding to, redressing biases and inequities in the short, intermediate, and long term, as well as actively cultivating equitable institutional cultures and sustaining equitable institutional cultures. Okay, so I think I'm going to stop there because I've been talking a lot and I wanted to make sure that we had some time to have a conversation. I know that that was a lot of information that was shared, but I think that hopefully it sparks some questions and some thoughts and maybe even some worries that we can talk through. So thanks so much for listening, and maybe I'll pass the mic over to Wendy.
Great, thank you. Thank you, Lianne. That was really interesting, and I have lots of questions. But I'd like to, before I start, I'm going to open it up to the floor. If you have a question, feel free to put it in the chat, or I'm not sure if I can see people raise their hand. So maybe put it into a chat and we can discuss if you'd like. While you're taking the time to chat, maybe I'll put out my first layer of questions. My first question, I guess. I think what you've raised are like, you've raised so many complex issues that I could drill down on a whole bunch of different things. But I kind of want to go back to your slide where you're talking about thinking about like power and privilege are baked into the system. I thought that was a really powerful statement. So when we're running these violence prevention programs, that I think, like, if I think about, like, if we look at the effect sizes of them, some of them aren't as big as we'd hope. And my hypothesis is that it's because we're dealing with it sort of not at all the levels that we need to. We need to be dealing with it with those things that are baked into the system. And those inequities about power and privilege that are baked into the system. So I'm wondering if you can talk about, in your experience, about how do you build those collaborations to address that? Like, when when you talked about the ministry, I was thinking, are there things that you should be building at the ministry level that can address those kinds of things that are, sort of under the iceberg, that are influencing the climate that you're delivering the program? That's a big question.
It is a big question, Wendy. Always big questions. I think there are a few things, and I think our Alberta primary prevention framework that we're building is a really good example of how we can start to address some of those underlying drivers of violence that are baked into our system. And it might mean that teachers and community practitioners are supporting some of those efforts. They might not be the ones leading it or driving it, but I do think that they could be supporting and advocating and influencing. So, for example, we're really trying to work with the government of Alberta right now, along with community organizations across Alberta, to advance a primary prevention framework that targets root causes. So it is about how do we improve social inclusion? How do we help to ensure that everyone experiences socioeconomic status? And that means targeting things like poverty and targeting things like racism and targeting things like heterosexism. So those are the things that are happening at that provincial level to prevent domestic and sexual violence broadly. But I think that we can draw on those strategies and those lessons and ensure that they show up in our classrooms as well. So how are we talking about that iceberg where, yes, we have these expressions of violence that we want to mitigate or avoid, but then there's all these things, these structures, these cultures, and our ideologies and our worldviews underneath that iceberg. And how do we begin to target those or have conversations around those as well? So we cannot separate a conversation around healthy relationship skills and things like communication and consent and conflict resolution without also talking about how power and privilege are a part of that as well. So I see it as a hand-in-hand conversation that needs to continue to happen. Does that help?
Yeah, that's good. I'm going to follow up, but I'm going to go to the chat box first. A comment from Lena Algomeri. Lianne, this was excellent. So much to unpack. Thank you. If you had to think about one thing that stands out for you the most for when you think emerged from this implementation project that has resonated with you, critical about scaling evidence-based models, what would you say? What's the one thing that stands out the most when you think about scaling up?
Okay, I'm going to cheat and give two. The first is that collaboration at the institutional level and partnership at the institutional level is key, because until that happens, teachers and practitioners are going to feel like they're doing it off the side of their desk. And it really bleeds into ineffective implementation and lack of fidelity to the program. So I think that partnering with PREVNet, with Western University, with school districts, with organizations, and with the government really stood out as being critical to have the kind of reach that we did. But the second is, I think I said this in the presentation, scaling is one thing, systems change is another, and scaling is often a part of systems change, but it isn't systems change. And so it goes back to what we just talked about, Wendy, where how do we get at those underlying drivers?
Okay, I'm going to come back to that, but I'm going to give the other questions first. Were there, this is from Thomas, were there any train the trainer programs for youth to attend and to be trained in your models?
Oh, no, we chose the 3 programs that really focused on adults implementing healthy relationships programs and practices with youth. But I think you raise a really important point about how do we leverage the skills and gifts and leadership of youth to also influence and support other youth.
Yeah, it's interesting because having been a part of one of the partners, I would say now, when we first started, our view was that if we couldn't change adults, we wouldn't be able to change youth. And so we started with focusing on providing adults with the skills and training them with the skills. Now, many years later, I think I would have said our other group that we should have maybe included as master trainers and champions would have been a group of youth as partners, because I think that would have been critical to get their feedback. That's one of the lessons I learned, I think.
Yeah, I think that's a really great point. And I would also add parents as leaders as well. And that I didn't talk about it because of time, but our current focus is around building the capacities of parents or primary caregivers of adolescents to also have conversations with other parents about healthy relationship skills. So I think you're right. There are other sets of leaders that we can leverage.
Yeah. Okay, Melody, see, I have to stop myself. I keep wanting to participate. Were the sessions in mostly urban centers or were there rural sessions too?
Mostly in urban, but also in many rural areas as well. So there was a mix. I can't think of specific areas off the top of my head. It's been a couple of years, but yes, it was both.
And were there some Indigenous areas too?
Yes.
Yeah.
Yeah.
Communities.
Absolutely.
Yeah. So it was really quite diverse in who you reached. Okay. This is hi, Lianne. This is Margaret Walsh from CDI. Could you talk about the fidelity measures you used?
I can't talk about it, but I wonder if Dayanara is on the call because she led the evaluation and research of the project over the years.
Oh, and just as you say that, she appears. It's like magic.
Yeah, I would like to respond, but I was at the dentist, so I just got on 10 minutes ago. So were these the fidelity tools for like 2015, 2016? Is that what we're talking about?
I think at any point during the scaling, so between 20,
Sure.
yeah, at any point.
Okay. Hello, everyone. I'm Dayanara. I worked at Shift as a postdoc and now work with PREVNet. So yeah, we used tracking tools. So there were tracking tools for every session in terms of activities that were completed and feedback, so we could see sort of what was getting missed and understand if there were things we needed to do to improve training or technical assistance. We did start beginning and end of year surveys to sort of see how folks' experience was overall. We did focus groups and interviews to understand the lived experience of implementation on the ground. And then we also did something called the Hrpp, which is about measuring changes to organizational practice. It's really hard in most places in Canada to do any kind of observation. So we didn't have that in this case, which would have been really nice. But we have published some of the fidelity data we used in a Canadian Journal of School Psych publication. So if you're interested, you could email me or email PREVNet or Wendy, and we can get that to you. So
Can we put it in the chat?
Oh, my email?
Yeah. No, I was thinking the reference.
Well, okay, I'm on my phone. I'll try my best. Otherwise, I will put my email in and you can email me. Yes.
Okay, thanks for jumping in and being a part of it. Okay, I'm going to go to Sarah. Thank you for addressing funding because this is a key barrier that our team is working through. Can you speak to what the funding model looks like after your current funding finishes? Is this an expectation of the implementing organization? What about material/resource costs?
Yeah, that's a great question. And the project did end a number of years ago. And there was a slow transition, but eventually, yes, schools and community organizations that wanted to participate that hadn't already would be required to pay for the resources and pay for the training. And when we added up the cost for each training, because we sent letters out to each school letting them know how much they were receiving in kind, it was about a $2,800 per training or per location. So that included the resources, flying the master trainer out or having to cover their travel and their stay. So it is a fairly significant amount of money.
So,
oh, sorry, I was just going to finish up by saying, but our hope is that we created this system, this infrastructure and we were able to hopefully reach all the schools and communities that were ready at the time.
yeah, so I think that's an ongoing problem. Like getting funding for sustainability is absolutely critical. And I think we have to start to think about how we advocate for these programs differently, because I kind of think about it as an ethical issue. We put something in place because there's a need. And then when we run out of funding, the need has not gone away. It continues, but we're now in an ethical position where we can't offer that. So I think, Sarah, that's a really important issue. And I think we have to do much more system advocating to indicate that sustaining programs is something that we should be funding and really concerned about. Okay, sorry, I interrupted again.
Oh, no.
So Stacy's going to send you out the articles and the links, or the links to the articles, because we're going to send out when we send out the link to this presentation. So we will get those to you. So not to worry. Okay. The next question is again from Lena. Sorry, another question. Nope, they're all good. every question's a good question. Given the impact of this project and the learning, what now next to continue leveraging what has been achieved?
I might pass this question on to PREVNet, because I think we created this momentum, and then we slowly transitioned away from it. But we had created this infrastructure that we had hoped that Western or PREVNet would, leverage or build on. And so that might be a question for PREVNet. But I can also talk about some of the work we're doing with parents after that.
Maybe I'll let you do that.
Oh, okay, sounds good. So one of the big learnings out of this scaling project was that parents, even though they were part of it, it was kind of underused, right? And parents were generally not as engaged. And yet the research shows that parents aren't really aware of ADV. They're not really having conversations with their adolescent children about healthy relationships. So the next phase of Shift's work has focused on how do we engage primary caregivers in ADV prevention. And we've been building an approach that changes the environments where parents naturally go, so their workplaces, religious settings, and even the extracurricular settings of their children and youth. Changing those social environments, leveraging key influencers in those settings so that parents who have influence can share and disseminate information. And then we're also embedding a text-based intervention that targets parents directly with brief information, links, and capacity building bits that will help parents to also have productive conversations with their children and youth. So that was the next iteration of our work, was really zeroing in on parents.
Yeah, and that's interesting because then we sort of went the other way. It's PREVNet. Like we didn't go to a stakeholder group, but we went to creating community of practices that represented people who were delivering the programs to see if we could support their capacity and sort of leverage that way. But I think sustainability is a really important question, and we all need to think deeply about how we can advocate together to do that work. I think clearly we have to have you come back because there are lots of questions and there's still more to unpack. I have more, but we are running out of time. So I just want to, if anybody has one last question, give you an opportunity to get it in the chat, and we're happy to take it on. And yeah, I'm glad that you got a chance to talk about your Connect program with parents, because I think it's really, really important. And in fact, as I listen to you talk, I think that's the next talk we should invite you to come back and do, because I think lots of people would benefit from it. Dayanara has also indicated that she has several articles on sort of the implementation and the fidelity evaluation. So there's one in prevention strategy. And so we're happy to make sure that people get that. Not seeing any more questions. I'm going to just then take this as an opportunity to say thank you so much, Lianne. I found what you've done is you did two things that were really important for me, which is you really talked about, how do we build collaborations and different kinds of models of how to implement different programs that are aimed at achieving the same goal, and thinking and helping us think about how we can do better in those models, and helping us think about that change doesn't just happen through the program, and I think that's often what we do when we get funded to do our program. We look for program changes, and you've actually flipped the box and talked and really thought us about how do we leverage program changes, or how to also bring about system change and going outside of that, and that's a really important goal if we're going to get at some of these underlying structural barriers that might be influencing the extent that our programs can be effective. And also the other huge benefit is that we're going to bring more change over time. And so I really appreciate your perspective and the work that you've done. And I want to highlight the value that it takes a village. And we're so grateful that we have you as part of our village, and also as part of the village of people who are dedicated to doing this work in Canada. So huge thank you for the presentation, and thank you for all the work that you do.
No,
and we look forward to your next presentation.
Yeah, anytime. I'm happy to be back as a presenter or participant. So thank you so much, everybody.
And thank you for taking the time today to attend and participate. In today's webinar, just want to remind you that Stacy has put in the box the link to our Qualtrics survey. So please take an opportunity to provide feedback and also get your certificate of attendance. And also a huge thank you to Stacy, who always is behind the screen, and you probably are wondering what she looks like, but she actually makes everything run and makes sure that it runs smoothly. So thank you all and have a great day and stay safe and healthy. Bye.